Do you think that Botox affects the muscles and that filler only fills in wrinkles? If so, then this video is just for you, because I'm sure I'll surprise you in it. In this video, I'll talk about a new trend in aesthetic medicine, namely myomodulation. I'll explain what it is, why you need to know about it as a patient, and I'll also show you the good and bad effects of myomodulation. Myomodulation has only recently started being talked about. I first heard about it a few years ago, but it's only been taken seriously as a leading topic at conferences for literally a year, maybe two. But what exactly is it? Myomodulation is the process of influencing the activity of facial muscles, not with Botox, but with fillers, such as hyaluronic acid. So the idea is that we can affect facial expressions not only with Botox and muscle paralysis, but also with hyaluronic acid. What I just said raises more questions than answers. First of all, how is it possible that a filler could influence facial expressions? Secondly, why use fillers for this purpose if we already have Botox? Thirdly, which of these two products is actually better? And finally, fourth, what could go wrong? You'll find precise answers to all these questions in the rest of the video, so be sure to watch until the end. Let's start by explaining how it is possible that a filler can affect muscle activity. Myomodulation using hyaluronic acid works completely differently than Botox. Botulinum toxin causes facial muscles not to contract as strongly. It's a liquid, like water, which disappears completely from the body within a few days and is invisible at the injection site. And what about fillers? Fillers have the specific characteristic that they remain in the body for many months. In terms of consistency, they are like a gel. They are designed to replace the loss of subcutaneous tissue, which increases for all of us as we age. So, a filler in gel form replaces the fat lost from subcutaneous tissue as we age. To put it very simply, if we look at the body from the inside, we have bones. On the bones are muscles, and on the muscles is the skin. And now, to the point. Hyaluronic acid changes the way facial muscles work, because when the muscles contract, they now have to move not only the skin, but also the filler that was introduced during the procedure. Such a filler has its own weight and volume. Even 1 or 2 milliliters of hyaluronic acid in a specific area can significantly affect the work of facial muscles by adding extra weight to them. I can compare this to the gym, when you add more weight to the barbell. When you do another repetition with more weight, it's a bit harder, or you might not be able to complete the full movement like a squat all the way down. It's the same with fillers. On the other hand, continuing with my gym example, when you don't have the strength to complete the full movement, like when doing a pull-up, you can use a resistance band to help you perform the movement and pull yourself up. We can relate this to our facial expressions and fillers. By injecting hyaluronic acid under the muscle, we positively influence this resistance. So with the acid, we can improve the function and efficiency of the facial muscles. And that's a cool feature that not everyone is aware of. Exactly. Can myomodulation, that is the effect of loading or unloading the muscles, be something bad? Absolutely and definitely yes. At the beginning of this video, I mentioned to you that conscious myomodulation has only recently started being discussed with the aim of using it to our advantage. However, we've been seeing the negative effects of loading the face with acid for as long as aesthetic medicine has existed, haven't we? I'll go even further. I'm sure you've seen motionless and altered faces among Hollywood stars, and even among your friends or strangers on the street. Botox is often blamed for this artificial mask-like effect. But the truth is completely different. It's actually about the negative effects related to myomodulation. So, if the filler is administered incorrectly, if there's too much of it, or if it's placed in different areas and layers than it should be, it can easily lead to an artificial appearance and altered facial expressions in the patient. And of course, that's exactly what we don't want. However, the practitioner must fully understand the consequences of administering filler not only for wrinkles, but also for facial expressions. Based on what I've shared so far, you might conclude that using fillers only changes facial expressions in a way that's unfavorable for appearance. That is, this added weight and the introduction of something artificial only lead to artificial effects. Fortunately, the reality is exactly the opposite. And now, I'll tell you about the tremendous benefits that come specifically from myomodulation. To make this easy to explain, imagine an elderly person. An elderly grandfather or grandmother who uses a removable set of dentures. You've surely seen how much the appearance of such a person's face changes the moment they put their dentures in a glass for the night. In fact, the entire lower part of the face changes its appearance. This happens because the skin lacks support in the area where the teeth would normally be. This causes the lips to fold inward and, generally speaking, the tissues to recede inward. But why am I mentioning this now? And what do fillers have to do with it? The point is that as we age, we lose subcutaneous fat tissue. That's why the cheeks become more sunken, there's excess skin in the lower part of the face, the temples hollow out, and tear troughs form under the eyes. In other words, the natural curves of the face that we had in our youth disappear. It's somewhat similar to taking out a set of dentures and putting them in a glass, but this happens gradually over the years and affects the entire face. The skin loses its natural support in the form of subcutaneous tissue, which used to be there but is now gone. And now pay attention. This phenomenon also affects the function of facial muscles. Because if we've already said that overloading the muscles with fillers significantly changes the face, then in the same way, relieving the muscles also affects facial expressions. That's why skillful use of hyaluronic acid and restoring volume where it has been lost with age can bring excellent results for facial expressions. And this is exactly what good myomodulation is. An interesting example is the forehead area, because there we have strong facial muscles, and just like everywhere else, we also lose subcutaneous tissue there. If there is such a need and we decide to fill the forehead with hyaluronic acid, the forehead will have fewer wrinkles and the movement of the facial muscles will feel more natural for the patient. When making facial expressions, the patient will look, for example, like they did 10 years earlier. However, the forehead area is definitely not the only place where we consider myomodulation. The second important area on the face is the cheeks. Here, a lot can go wrong with fillers, by overfilling the cheeks and weighing down the face. However, when used properly, the product can make the face more mobile, and for example, a drooping corner of the mouth may not droop as much as it did before the procedure. Other important areas for myomodulation include the lower part of the face. For instance, shaping the lips with hyaluronic acid affects the function of the orbicularis oris muscle. New lips affect the way a new smile looks. Furthermore, shaping the chin with hyaluronic acid or filling in the corners of the mouth will also influence the smile and the expressions of the lower part of the face. Take a look at all these examples of well-performed and well-utilized myomodulation. There are countless examples, but what is certain is that administering fillers is not just about removing wrinkles, it has many more consequences. I would also add that the latest treatment protocols combine myomodulation, which you already know well, with neuromodulation. Neuromodulation, in other words, refers to treatments with botulinum toxin, where we influence facial expressions, but using different tools. The goal among the best specialists in aesthetic medicine is very clear. The idea is to achieve the best and most natural result after the procedure with the least possible intervention. Aesthetics medicine, when practiced wisely, delivers results that are consistent with the patient. Why did I record this video about neuromodulation, which is, after all, a very scientific concept? Definitely not for reach, because with such a topic, that's not possible. However, my goal is much more important than reach. With this video, I wanted to show you that the consequences of administering fillers into the body are much greater than what you might gather from a short Instagram reel, where someone shows before and after results. It's important that before you go to the clinic, you know about both the good and potentially not so good consequences, so you can make the right decision. However, the truth is that it's not your responsibility to know everything about the product. That responsibility lies with the doctor who will be performing the procedure. That's why I have a very important video for you, which could change everything when it comes to the results you get from aesthetic treatments. I've recorded a specific video where I explain step by step how to choose a great aesthetic medicine doctor for yourself. The thumbnail for this video is now showing on the screen. Click and be sure to watch to see the methods I recommend. Thank you for today and see you in the next video.